Yes, please.
As private practitioners, we often are, or we're being put into very uncomfortable situations where we're being coerced into signing in with the major medical aid providers as preferred providers. And they have, I don't mean to sound paranoid, but they clearly have an agenda with us. They want us to work for them, then we're working for ourselves. And we're not sure where this is going, but I don't think in a good place. And I was wondering, is there a bail-out clause, and are we protected if we decide that we are no longer going to kind of dance to their tune, which is very interesting. And secondly, you know, there are often situations where we, for example, want to perform an expensive investigation, like an MRI scan. I'm not suggesting anything much more expensive than that. And the patient isn't signed up for that kind of insurance. And, you know, where does this Protection Act kind of protect us? Because we land up being in the middle of all of this mess all of the time.
Well, thank you so much for raising that question. That is such a fundamental question. And I should have actually thought of it. And it really is important. Anyone with the most basic knowledge of medicine will know that the less time that you're compelled to spend with the patient, the less efficient your workup is going to be, the less thorough your diagnosis is going to be, and the less appropriate the treatment prescribed is going to be. And we see what's happened in Canada, where doctors are given a maximum, you can earn X per annum, and you've got to see no matter how many patients. And we know if you want to be a preferred service provider, and I think the larger medical aids, as I understand, are perhaps the most prescriptive, there's a very real challenge to your professional integrity and a risk that you may be sued for inappropriate care. And the question is valid, how do you protect yourself? Because on the one hand, it's almost blackmail. If you don't give in to the terms, you're not going to be a preferred service provider, and X million patients, or a percentage of X million patients, are not going to come your way. And that's quite a decision to take, particularly if you service a particular socio-economic range where you practice, most of whom in that range belong to a particular medical aid. And it's a hard one to answer, because if you spell it out in acceptance of the contract and you insert an additional clause to say that you are required to indemnify me with respect to any litigation, any claims against me arising out of my complying with your formulary, or whatever you want to call it, that would be the way you could protect yourself. But you could take poison that you will not get the appointment, or if you have the appointment, that it will be cancelled. And I think it's got to be dealt with at a governmental level. I think SASOPA, right, whatever, your professional organisation needs to lobby with the organisations representing other specialities. SAMA needs to do this, because doctors, let's face it, with your doctor, we're small people. You know, I mean, we're not major corporate entities. We don't have shareholders' capital. We don't have anyone to sort of defend us, and we have to look to our professional organisations and at the end of the day government. And I really think the time has come for SAMA, because the Health Professions Council in essence is more of a state body these days. It's not really what the SA Medical Dental Council used to be. Needs to lobby government vigorously that legislation needs to be put in place, that in each speciality there are certain minimum standards which a medical aid cannot compel a practitioner to agree to less to. You raise MRIs. I mean, the MRI today is absolutely vital for a whole range of diagnostic procedures. What about if you've got a patient who's got an astrotumor and you want to stage it? You have to have a PET scan. So most medical aids say you can't have a PET scan, but there's no other way to really stage their tumour except for a PET scan. And that's such a vital question. And really I urge all of you to be having a business meeting, maybe it's a time to raise it, but then to liaise via SAMA, because that's the umbrella organisation. Get together with Minister Motsoaledi, who I understand is very approachable, and perhaps even the National Consumer Commissioner. And she's quite a feisty lady, which I like, and she's giving everyone hell. Hope not the lawyers, not yet. And try and lobby her to join in the plea that clinical standards should not be compromised, because medical aids are profit-driven. At least the administrating companies are, whilst the medical aid itself, controlled by the trustees, is not. The companies that administer, and I saw the report of the Council for Medical Schemes, one medical aid made a profit of 16% of contributions. That's a lot of bucks if the turnover is like, I think it was 1.7 billion. I wouldn't mind 16% for no risk and for really, not much work, basically a computer program. So thank you for raising that. Vital.